The next event, it will be looking at local networks in primary healthcare. These are called primary healthcare organisations, and they're one of the key elements that the Prime Minister has announced will form part of his overall health reform package. Well, we've got, as usual, a panel of experts, and we're looking forward actually to a very lively discussion on this topic. We have Associate Professor Dr. Jackie Cumming, who's from New Zealand, who's a researcher in health policy in New Zealand and has worked particularly closely around the arrangements in that country to introduce local primary care networks there. We have Professor Philip Davies, who's from the University of Queensland, has worked internationally in health, including in New Zealand, and is a former Deputy Secretary in the Australian Department of Health and Ageing. And we have Dr. Emil Djakic and Dr. Andrew Pesce from the AMA. Dr. Djakic is from the Australian General Practice Network, and these people are actually at the cutting edge of policy. They're the ones dealing with government around reform, dealing with their own members, and so we expect they will have very strong and perhaps interesting views on some of the questions that the experts will raise in the discussion.
Tell me about the National Health Reform Series and what's happened so far.
This is the third of a series we're having around the health reform questions. We've already looked at the health workforce, and we've looked at how people can better access the health system. And it's clear from those two events that there is no simple answer to the health reform in this country, and that we need to keep looking at questions, and it's now timely to look at how general practice itself is organised, particularly in terms of what local arrangements there should be, and this builds on the Prime Minister's announcement that hospitals he proposes to fund locally, and he proposes to have similar arrangements in primary health care. So we need to look at, well, how might all these networks fit together? He's also talking about networks for aged care. Very important question, very interesting question, raises all sorts of issues that will need to be thoroughly thought through before we proceed.
Who would be interested to watch this event?
Well, most of us actually go and see a GP at least once a year, or we see other healthcare providers, and so most of us, I think, will actually find this at the core of what health reform is really about. But it'll also, I think, be of particular interest to researchers in health who can contribute obviously to the debate, and to people who are involved in policy, whether within government or involved in lobbying governments or in national bodies that help deliver some of these programs, how best they can draw on the information that is around, and perhaps be better informed about how things might proceed into the future.
So people can watch this online?
Yes, it'll be a public event, both here physically at the ANU, but we're encouraging as many people as possible to tune in online, and we will be more than delighted if people online can submit questions on the day, and we'll have these experts answer those questions as best they can.